Today, the World Health Organization announced that it has received reports of more than 132,000 cases of COVID-19 around the world. 5,000 people have died so far due to the virus. This as the European Union urges its member countries to put health screening procedures in place at their borders to limit the spread of the coronavirus. More than 22,000 cases of COVID-19 have been confirmed across Europe, now named the epicenter of the pandemic by the World Health Organization. Joining us now to talk about the impact the coronavirus is having here in our country is Dr. Grazie Christie, Senior Policy Advisor with the Catholic Association and a practicing radiologist. She joins me now by Skype. Grazie, welcome back and great to see you.
Thank you, Tracy, for having me.
Well, in Florida, as one of the many states affected by the coronavirus, what are you seeing there in Miami?
Well, there's an air of panic, which is sad to panic, but we do have to take things very seriously. People are stocking up and starting to think about their children not being in school next week. Most of the schools are being canceled effective Monday. This is going to be a serious blow to take care of the children and keep them indoors. And what we're facing it strong and brave, the same way the rest of the country is doing it.
Can you talk a little bit about how the virus is impacting the elderly and those who may be immunocompromised or have other health conditions?
Well, as I think all of us know by now, that the elderly and those who have other chronic illnesses or immune compromised are especially susceptible to the illness, to having the acute respiratory infection part of the illness that does land you in the hospital and can be very serious. So elderly and chronically ill people need to be especially careful to stay out of crowds and maybe should start thinking about staying home entirely, and always to keep in mind that any symptoms they should check with their doctor. Recently, a lot of telemedicine restrictions have been lifted, and people are going to be able to access a lot of telemedicine that they weren't before, and this is going to be very helpful.
Grazie, I've been hearing a lot about how it impacts the lungs and pneumonia. Can you explain that a little bit more and why that's so concerning?
Well, it's very concerning because it causes an acute respiratory distress. The lungs where the oxygen is exchanged now between the air that we breathe and our blood. The lungs get full of liquid, and the patient basically has a lot of difficulty breathing. In the ICU, they're able to support the breathing with oxygen, and many patients survive even when they have this very serious response. So it's very important to watch for any symptoms, especially shortness of breath, cough, fever, but once you start feeling short of breath, you really need to reach out to your doctor and maybe make your way to the emergency room.
We've also been hearing a lot about washing our hands and using hand sanitizer. Can you talk about, from a medical perspective, best practices and why those are important?
Well, I think what's important is for every one of us to remember that we each need to take a role in fighting the spread of infection. Everybody can stop shaking hands. In Miami, we can stop kissing. And everybody needs to practice that hand hygiene. Wash your hands continuously, all the time. Do not touch your hands to your mouth. That is the biggest way that we spread the virus, to ourselves from surfaces. And everybody who suspects they might be ill, who suspects they might have a fever, who has a cough, needs to stay away from others, because you could be transmitting the infection even if you only have a light case.
A lot of people are also stocking up on food and water. What about prescription medications? Should we do that as well?
Anything that's going to take you out of the house in order to make that shopping trip, that is something you should probably think about stocking up on. Medications, I hope will not be affected as far as the distribution of medications, the supply chain. But if you are on a medication that you need to take every single day, you might want to get that in advance and not have to be making constant trips to CVS or to the local pharmacy the way that all of us do.
Yeah.
So do think about what you're going to need every day, and if you can stock up, do so.
Really good advice. Quickly before we go, though, I do want to ask you this. You're a doctor. I know that you're a mom. For us parents, what should we keep in mind when talking to our kids who maybe are having a hard time with this and making sense of it all?
I think that we should concentrate on the fact that we live in a wonderful country where all of us are going to work hard together, along with the government, the private sector, a really wonderful medical system that we have, and we're going to take care of each other and all of our sick, and keep hope and faith alive. Help each other with our faith also. This is the time to build our faith, to help our friends and family strengthen their faith. And remember that we are never alone, even in the most serious crises.
Absolutely. Gracie, thank you so much. Thank you for saying that. Dr. Grazie Christie, Senior Policy Advisor with the Catholic Association. Thanks again, Gracie.
Thank you.